Good afternoon, everyone, and welcome on this rainy day. I'm Dr. John Mendelsohn. I'm the Chief Medical Officer and founder of DxRx Medical, and I'm here to share with you our revolutionary new treatment system for excessive drinking and alcohol abuse. But before I tell you about what we do, let's meet Mike. Mike is actually a very typical alcoholic, and he's not your stereotypical patient. He's in his 30s, he's successful, he's married, he has a career, everything is going his way. But for many years, Mike has been drinking heavily, and his drinking has escalated to the point where he no longer is in control. He can't stop when he needs to. So eventually, Mike hits a wall. In this case, literally, and not in front of his family. And now his problem is out in the open. Everyone can see what's going on, and he knows it needs to be addressed. So Mike goes to his doctor, and she recommends AA. He tries AA, but he finds it shaming, and he finds the stigma of being exposed as an alcoholic just too much to take, so he stops going to meetings. He looks at rehab, but rehab will take a whole month of his life off work, plus cost an enormous amount of money. So what's he do? He does nothing. He continues to drink. His life spirals down. He loses his marriage. He loses his job. He loses his family. He loses his dignity. Now he looks a lot like the stereotypical alcoholic that you all think about. Turns out there are a lot of people just like Mike in the United States. 34 million people are diagnosed in the United States with the alcohol use disorder. Yet only 2.5 million of them get treatment in any year. And the ones who are treated spend an enormous amount at this basically end-stage treatment. DxRx has built a treatment solution available for all people with alcohol use disorder and excessive drinking. And our solution is available today and doing very nicely. So we have expanded the treatable market. Our solution is unique in several ways. It's private. It's done at home using a telemedicine platform. There's no shame or stigma involved. We use FDA-approved medications like naltrexone, and we use breathalyzers, which quantify alcohol use in real time to monitor behavior. Our outcomes are patient-driven. Because we treat earlier, we're able to return people to social drinking as well as to support abstinence. There's no other service like us at all. So you can think of addiction as sitting at the intersection of biological, psychological, and social factors. We attack the biological portions by using medications that are, again, safe, effective, and approved, and physician management. We attack the psychological portion using breathalyzers to monitor behavior in real time. And we have care coaches and counselors who provide needed therapy. Our social platforms allow integration of people from the outside, including family members and spouses, and provide a network effect for patients to maintain their treatment goals. Let me show you exactly how it works in this little video. First, patients find us on the web, they download our applications and install them. Second, they have a comprehensive medical vision with our expert physician, where a treatment plan is crafted. Third, they are prescribed medication, and we assure medication adherence by photographing the pills in their hand as they take them. Fourth, they breathalyze twice a day in a very easy ritual, and this documents their alcohol use. Next, they involve their inner circle in a social network who supports their recovery. And finally, everyone gets to see their drinking decline over time. So, does this treatment work? It does very nicely. What you're seeing in this slide are data from our first 12 patients looking at the percent alcohol reduction over the one-month period. And there are several features to notice. Number one, we get a 60% decline in drinking over this time period. That's impressive. Many of our patients do attain sobriety if they want to obtain that. So we both suppress drinking or patients attain sobriety. The second thing to notice is that dense data matters. We have data every day on patients, and that's really important. No one else has data like this in almost any treatment field in medicine. And finally, patients stay with us. Our 30-day retention so far has been 100%. So why does all this work? How come no one else has come to this? Well, problem drinkers have a chronic condition, and we know that. And we know there's no cure for addiction, so we need to stay with our patients every day and we do that by providing empowering, light touches that keep them engaged. Because addiction is a disease of denial, we provide objective feedback so patients know what's going on and have real numbers to work with. Because drinking destroys relationships, we've created an inner circle of people of those people that are important to the patient to support their recovery. And because stress causes relapse, we're there when patients need us, not at some random office hour, but when they actually need us to come to them. We've been up and running and enrolling patients, and we're showing a 30% week-over-week growth rate. And most importantly in this slide, 80% of the patients we're enrolling have never been in treatment before. We're reaching a new market and a new group, and hopefully this will prevent the declines you see with alcoholism. Since joining IndieBio, we've achieved many of our milestones. We've launched our services, including our web-based services and our apps in early December. We filed 4 patents to protect unique components of our services. We've enrolled our first cohort of patients, and they've completed 30-day data. And we partnered with key players in the healthcare industry, including a Yale hospital that's hoping to decrease recidivism and readmission, the National Institute of Health, the National Institute of Alcoholism and Alcohol Abuse, who want to deploy some of their apps on our system, and Dignity Health, who wants to also decrease readmission rates. So for any treatment to really work, to be really accepted, it has to be both available and effective. And you can think of rehab as being moderately effective, but not very available. It just costs a lot of money. And you can think of AA as being very available, but not very effective. Our treatment is both effective and available, and will become the benchmark for addiction therapy in the United States. Our business model includes a portion of patient payments and insurance payments to yield about $300 per month per patient. This gives us a lifetime treatment value of $1,200, and we have 50% estimated gross margins. Our total available market at these prices is $38 billion. Our team is pretty darn impressive. I'm the, well, maybe not me, but the rest of the team is, certainly. I'm a physician, I'm an internist and clinical pharmacologist. I've been conducting NIH-funded research in the addictions as a principal investigator for 30 years, and I've also been in practice about that long. David Deacon, our CEO, has launched 4 of his own companies, 2 led to successful exits, and he's been an angel funder in 20 others. Bob Nix, our CTO, has spent the last 9 years at Athena Health building out their systems, and before that was Vice President of Engineering or a founder in 7 other companies. Our scientific advisors are the leaders in the field. Chuck O'Brien developed naltrexone for alcoholism. Ivan Diamond's a molecular biologist and founded the UCSF Gallup Center. Warren Bickel, his work sits at the intersection of psychology and technology, and all are awarded, recognized experts from NIH and the addiction research community. So, are we just going to do alcoholism? No. Our systems will also work for opiate addiction and nicotine addiction, and we will move to those as well as soon as we get this really working well. So, everyone in this room has a friend, a family member, a colleague, a neighbor who's been felled by alcoholism. And if you really care about those people, and you really care about your communities, and you care about yourself too, because it affects all of us as friends and family members, then we're raising a $3 million seed round, and we'd like to have you join us. Please find us afterwards, and we can talk. Thank you very much. Good afternoon.